representation of the National Movement of Voice Speaker of Brazil, the African Reclaimers Organization from South Africa, the Popular Economy Workers Union from Argentina, the Union of Auxiliary Personnel of Private Houses from Argentina also, the Zimbabwe Chamber of Informal Economy Association, and the Self-Employment Women Association from India. Next slide, please. Next slide, please. Well, we want with this webinar to provide an overview what is happening with the access of COVID-19 vaccination and why it's so important for the workers, but also for economic recovery. Try to create a platform or a space that allow workers and MBOs, organizations to share its experience on advocacy for access to vaccination, and try to start or continue the discussion among WIEGO and networks, and the WIEGO networks, of course, how one can support workers to engage in vaccine advocacy. Next one, please. The agenda. We spend a little more time in these instructions for translation and doing some logistic, but we go straight forward to the point. First of all, we will provide a brief background on what's WIEGO, what's the work in its networks, and why and what is our work exploring what happened with the pandemic and informal workers. Then we will provide a brief overview what is happening with the access to vaccine. Then why it's important for the workers in informal employment and for informal recovery. And then we go to the core and more important part of this webinar, which are the experience of the workers in informal employment around the world. We will close the session with a Q&A, so brief, and trying to project next steps. Next slide, please. Well, WIEGO is a global network composed by organizations of informal workers that compose networks by itself, researchers, and development practitioners. We are in more than 40 countries and work with 4 main sectors, as are the way speakers, street vendors, home-based workers, and domestic workers. The networks of informal workers what we work with are StreetNet International, the IDWF, HomeNet International, the Global Alliance of Way Speakers, and Self-Employment Women Association, SEWA. Many of the organizations who will present are part of one of these or are members of these networks. Next slide. Give you the floor, Christy.
Hi, everyone. So my name is Christy, and I'm working with Federico at WIEGO. I'm the Workers' Health Coordinator. So I am going to talk to you about specifics of how the pandemic has actually impacted workers. So at WIEGO, we have led research across 12 cities across the world, and we've involved workers themselves, the organizations within our networks to actually explore the impact of the pandemic on workers. And what we noticed were that workers were impacted in a variety of ways. So firstly, workers have had their health impacted. We noticed in the first round of our research last year that symptoms of COVID-19 were actually present in up to 22% of workers' households in those cities that were particularly badly affected by the pandemic. So that's more than, that's between a fifth and a quarter of workers surveyed. And also workers have spoken a lot about an increase in occupational health risks to their health that they're facing while actually delivering their goods and their services. So I've got some statistics here where we've seen 61% of waste pickers reporting these increased risks, including 97% in Ahmedabad in India, 92% in Lima, Peru, and 81% in Durban, South Africa. So that's very, very high. Of course, the impact is not just on health, it's also on workers' ability to actually work. So we've seen that 74% of workers said that they were unable to work completely last April due to the pandemic. And of course, the loss of ability to work affects your earnings. So we've seen during the first lockdowns last year that workers took home only 19% of their their earnings before the pandemic. So that's less than a fifth of what they were actually making before. And after these first lockdowns, workers still only took home only 56% of their earnings. So it's had a huge impact both on livelihoods and health. So now let's talk about the global picture of access to vaccines. So we know that COVID has had a massive impact on workers, and vaccines have really, really presented a way out of the pandemic, and a very important tool. But there remains a huge problem. There's massive global inequity in vaccine distribution. So this map here is taken from Bloomberg, and it was updated. This is the most up-to-date version of this map. It was taken this morning. And as you can see, the darkest green areas are areas where they've had the highest amount of vaccine coverage. And the areas which are lighter green or closer to white are areas where they've had the lowest vaccine coverage. So as you can see, areas in the so-called global north predominantly have had access to vaccines. But areas, for example, most of Africa, South Asia, Southeast Asia, and some parts of Latin America as well, you can really see that they've had lower access to vaccines. Now, why is this important? Well, low levels of vaccination mean that we are at risk of more and more waves of COVID infections. And having this low level of protection through vaccines encourages new, more dangerous variants of the infection to develop and spread. And all of this creates a huge amount of uncertainty, which disrupts the ability of global and national economies to recover. And this is particularly important for workers because the majority of the world's workers live and work in these countries that have poor access to safe and effective COVID-19 vaccines. So this picture is a very troubling picture, but it's very, very relevant to issues for informal workers. Now, at WIEGO, we've started to engage a lot on this issue. And there are various initiatives out there that have been advocating for global equity in vaccine distribution. And at WIEGO, we've lent our support to various platforms by signing calls for action, open letters, etc. And so I've highlighted 3 here that we have lent our support to in recent months. The People's Vaccine campaign. So this is a global campaign which is spearheaded by Oxfam. It's supported by numerous governments, ministers, presidents, diplomats, and multilateral agencies and international organizations as well. There's also the civil society organization constituency of Gavi, the Vaccine Alliance, who we've also supported in their calls to action. And last but definitely not least, there's also Feminists for a People's Vaccine, which is a campaign which is led by the Third World Network and also Development Alternatives with Women for a New Era. And this is really important actually because they've really brought to the fore the perspectives of feminists from the global south, which is really important for issues on access to medicines because a lot of the narrative around this issue does miss an analysis of the impact of race, ethnicity, caste, income, wealth, geography, sex, gender identity, sexual orientation, disability, etc. And this is really important analysis that we need to have in our minds when we talk about this issue. And so FPV have been doing some really good work on this, and we've engaged with them on this. Now, once vaccines actually reach countries, there are still barriers that workers in informal employment can experience. And we know this through stories on the ground, et cetera, et cetera. So as you can see here, there is a screenshot from the online registration platform in India. So when you're eligible to actually receive a vaccine, you need to actually book your appointment using this website. Now, this is a problem for many who obviously do not have access to reliable internet connection, or may not even have access to internet at all. And that does impact many informal workers. There are other barriers as well. So for example, if vaccination clinics are located far away from where people live and work, if the cost of actually getting transport to reach those vaccination clinics is expensive, and if those vaccination clinics don't have opening hours which are flexible enough, that maybe they open in the middle of the day, they don't open in the morning or late in the evening, all of these things can really impact on ability to access this clinic. And of course, we have seen that undocumented migrants or workers without papers can also face exclusion from vaccination programs, or simply a lack of paperwork makes it difficult for them to actually actually access these programs. Now, of course, we also have the fact that in some places workers are discriminated due to race and caste, and there is really poor outreach to those workers on the part of authorities. And last but not least, workers who do not have vital social protections, including sickness benefits, may well, face major barriers in accessing a vaccine. If you're not vaccine hesitant, you want to access the vaccine, but you're worried that side effects may keep you away from work for a few hours or for a few days, that could mean a loss of income. And therefore, that's a very legitimate reason why people may not be able to essentially access a vaccine. So now we've come up with some key messages for different sectors, for each of our 4 key sectors, as to why vaccination is key for protecting workers during the pandemic. So I'm going to start with domestic workers. So domestic workers have played a huge role in actually alleviating the care crisis. They've been caring for children, caring for the elderly, and caring for sick household members. And they've been doing this in private accommodations, which has actually meant that they have been especially exposed to COVID-19 risk. And so vaccination really would help to protect them from the virus and help to bring the pandemic under control and really promote more stable working conditions. Street vendors, it's also a similar story. So, street vendors have faced a heightened risk from COVID because they've been working in a crowded environment, but they also play a key role in food security, providing fresh fruit, vegetables, and other food items. And they've also had really disrupted working patterns because of lockdowns and various restrictions as a result of the pandemic. And not just that, they've also faced a lot of harassment. And all of this taken together has led to a real risk to their livelihoods, as well as their health. So really, vaccination Again, it would offer increased protection, help to bring the pandemic under control, and stabilize working conditions. And Fede is going to talk us through the waste pick and reclaimers side as well.
Thanks, Christy. Waste pickers are in the first line, confronting and overexposed to the virus. Waste pickers provide essential service, even if they are not recognized. They are providing a public service related to the waste management of the cities. In a way, they are confronting also and protecting the entire population. That's the way waste pickers need to be framed in the cities by the governments, but also by the citizens. We really believe that waste pickers protection is a way of recognize that key role as essential workers in the front line. And it's so important provide not only access to vaccine, but also elements of personal protection and access to health system. Next slide, Christy. And the home-based workers are key actors of the value chain of many products. But thanks to the measures taken by the governments of social distance and the way that pandemic was confronted in some contexts, their value chains were disrupted. The supply chains were or confront obstacles. And this create a serious problem of financial insecurity. Vaccination would hasten the end of the pandemic and would bring the pandemic under control, allowing their business activities to stabilize quicker. Pass you, Christy, to the key message.
So what is the key message here around vaccination for workers in informal employment? Well, informal economy workers are frontline workers, as Fede correctly said, delivering essential services during the pandemic and have seen negative impacts to their livelihoods and to their health. Now, there are 2 billion informally employed workers across the globe, so they are essential for national, local, national, and global economic recovery. So if we don't protect these workers from COVID-19, then we as society, as a collective, are not protected. And if we're not protected, then the pandemic will be prolonged and economic recovery will be delayed. So essentially, vaccination for workers is an investment in them. And this is something that's so key to really bringing the pandemic under control so that workers can continue to deliver their key services and have their livelihoods protected while also staying healthy and safe. So now that we've given a short run through of the key issues that we're seeing at WIEGO on vaccination for workers in informal employment, we think it's really important to create a space where workers themselves can share their experiences of what they're doing in their contexts, how they're advocating for access to vaccination, all of these things. So we would love to invite you to listen to their stories. We have 6 workers with us today from all 4 sectors and from various corners of the planet. So we would love to invite Deborah Contreras to speak first. Deborah is a representative of Health Promoters of the Movement of Excluded Workers, MTE, and the Union of Workers of the Popular Economy, UTEP, and is from Argentina.
Deborah, I will share my screen with your presentation. Yeah, give me a minute and I will do it immediately. Confírmame que ves la pantalla, Debbie.
Could you confirm?
Listo, procede.
Hola, ¿cómo andan?
Good
Bien.
morning, everyone. How are you?
Bueno, mi nombre es Debora.
Okay, my name is Deborah. I am from the health team of the MTE UTEP, Argentina, And the reason the pandemic brought to us a set of new problems. In the case of popular neighborhoods, it was the cohabitation is not the same, and we were told stay at home, stay within your neighborhood, because we knew there were people living packed together, so to speak, and they couldn't really just observe social distancing in the case of COVID. The other issue was the unemployment issue. As informal workers, we had that problem because they had to go sell at the street in order to survive. And what this brought is that these people were no longer able to work, and that meant an increase in the the food, the rations and portions of food that we would deliver from our organization. So because we didn't have any incomes, the thing was that the demand increased in those portions of foods that we usually deliver. Another issue that the pandemic brought about was the fact that we were requested to stay home, and our colleagues were suffering, our women colleagues were suffering gender violence, and they had to stay home with their aggressor, and we didn't know what happened, so we had to intervene. We assisted several of our female colleagues during the pandemics in the context of gender violence. And another thing that led us to get, it was a warning sign and told us what to do. It was the fact that several colleagues from the organization passed away, and that actually was a warning, a red flag. And we started thinking how to promote the issue of vaccination, and also the mass media, the fear campaigns and misinformation. So we said, well, we have to go fight this. We have to address this, see how we can solve it. So that's the question that we had. How can we, from the organization, how can help? How can we help? What do we do in order to help? So we started an articulation with the state, both during the first year of the pandemics. We went to the different areas in the neighborhood, the different clinics, the flu vaccine for the elderly and for the colleagues that were still stalled during the pandemic. However, we worked twice as much in the territory, sustaining the food banks, and we went looking for the anti-flu vaccines because at the time there weren't COVID vaccines just yet. And then at the national level, we also went seeking for that, and we were offered several types of training regarding the vaccine. And we took those training sessions, but we had also to adapt. We had to adapt that to our territory and to our female colleagues. And that's how we put the content together so our colleagues could actually have access to that, because we have worked within different regions. What you see here are our colleagues that are health promoters in different neighborhoods and different provinces within Argentina. Also, we designed how to put together squads for health promoters within the neighborhoods. What they did was to inform our colleagues, and they took cleaning supplies, and we put all that together, and we brought some sort of peace of mind related to the fact that the vaccine was necessary, and observing the rules by the state was also necessary. We gave around flyers, we organized online talks, we met every 15 days to check the status, the statute of any province, the different, because, the different territories of Argentina have different problems. For example, in some certain neighborhoods, people had, steady incomes, but many of our colleagues lost their jobs as well during the pandemics. Also, videos with colleagues that fostered vaccination. They talked about the importance of vaccination. They were the reference of our movement, and they just published this videos, these awareness videos about the vaccination. And Well, this idea that the state was there and the state helped, that was actually struggle. We had to convince and talk about the fact that we were essential workers and that we needed help for the food banks because some people really needed that vaccine and that we needed to be considered essential workers so that we would be considered for vaccination even without registration. All our colleagues got a vaccine by respecting the order of their appointments and but because we didn't get that response from the state about being considering essential, however, from day zero, we were the ones articulating all those work. And if one of the colleagues was isolated, we would bring groceries to that person. And from the organization, we also worked with the retired center, which were the ones that suffered the most during this pandemic. And also some of our colleagues and ourselves lost grandparents. And so we went home by home taking groceries to prevent those people from leaving the house. That's the work that we did, and we were not recognized as essential, as essential workers, essential people. We were not considered that way. And afterwards, as I was saying, we made demands to the state, and then we got organized and used broadcasting material made by ourselves to raise awareness on the importance of vaccination. The colleagues from the different branches of our organization, the UTEP, also gave us masks and safety kits and everything, every type of PPE, but it all came from our organization, in fact. And what the pandemic left to us, other than the organizing aspect of it, we devoted ourselves to the health aspect and the importance of health at this particular time because we would be told, we would talk about health and we thought about, having our BP checked or having, our kids being seen by a pediatrician. But then we understood that health was actually having running water in our houses because for washing our hands, we need water, and there are several neighborhoods in our area which have no water. So we were requested to stay at home, and people in our neighborhood would share one single room with 6 other people, and that was impossible to observe. That made it impossible to observe distancing. And also, we brought to the agenda the issue of health. Um, the fact that we need to work at the national level. And then also we were recognized in terms of the trainings that we did and stuff like that. And we started receiving recognition from the state as health promoters and also the social organizations. And we did get a diploma, but in fact, it would be better if we could continue articulated with the state and health promoters and still be recognized as essential for the pandemics. But after the pandemics, the fact that we are essential in the territory overall. Thank you very much, Debbie, for your presentation. It was awesome.
Floor to our colleague Aline Sousa da Silva. She is president of CENTCOOP. She's representative of the Federal District in the National Committee of the National Movement of Waste Pickers of Recyclables of Brazil, and she's coordinator of the National Secretariat of Women and Youth of Unicatadores in Brazil. She's a great leadership at Latin American level in the waste pickers networks. Aline, thank you very much for being here. I will share my screen with your presentation.
Bom dia.
Good morning. I'm Aline Sousa. I'm a waste picker, and I am a member of the network CENTCOOP DF. and I'm in a cooperative of waste pickers with more than 1,000 waste pickers. I also represent waste pickers in the federal district, and I am also the coordinator of the National Secretariat of Women and Youth in Unicatadores, Brazil. And first of all, I would like to thank you for inviting me. I would like to thank you for including the waste speakers here. And it's very good for us to be here to contribute with our experience and be able to exchange what we have experienced with the pandemic as waste speakers, and also how it was for us to finally get vaccines. So I have some pictures here for you to see how it was the process for us. But before getting here to this point where you see these pictures on the slide, we had a lot of suffering. It was a huge impact for everyone, but especially for us, waste pickers. The situation was very sad. So I would like to tell you what it was for us, what it was that process for us. It all started with the pandemic when our job was canceled. Many of the waste speakers were forced to stop working. They were forced to stop going out. So what could we do with so many decrees, ordinances? They were forbidding us to work. So how we were supposed to survive? And our salvation were people and institutions that realized that we were not working. So they launched many campaigns to collect resources and food. So these actions of solidarity were what actually saved our brothers and sisters, because we received food so that our families could survive. But also we had to pay for our rent. We had to pay for the services. So we needed money, not only food. And unfortunately, with the lockdown, those pickers that had waste picking as their only job, the situation was very difficult. So we had to find a way to articulate what we did in order for these pickers to go back to work. So we had to stop working for 150 days, and this was enough to show that everyone was suffering with this. Pickers, the environment, the general population. So we started to work together with the government so that we could present a plan, an adaptation plan for the prevention of waste pickers so that we could go back to work and be considered an essential service. Luckily, this plan was successful. It was submitted for the approval of Anvisa. And after this analysis and approval, we gradually went back to work. So this allowed us to have some more dignity, because during the pandemic, it was very hard for us. So being able to go back brought alleviation for us. But we had to do some adaptations in order to return to work. And these adaptations were not only on the picking sides, because the thing is that the pickers understood how important it was for them to use personal protection equipment. So some of them didn't want to use masks before or special uniforms. Actually, many of them didn't want to protect themselves before, but now they understood that they had to protect their life, their health, and they realized that with this pandemic, there was no chance for them not to use PPE. And actually, this will be a legacy for us as waste speakers. We have to be protected. We have to wear PPE. Moreover, we are working a lot in environmental education. We were already working before that, before the pandemic, and we were talking about how to separate waste. But now we also have the role of helping the population on how they have to, or what they have to do with the waste, but that waste related to the pandemic, how they have to dispose of the masks, what is the right bag for them to put it, and this was new to us. So we were part of a very important process. At the beginning, our work was very precarious, and this actually got highlighted by the pandemic, how precarious our work was. So we as speakers, as waste speakers, had to change many of the things that we were doing. And as you can see on pictures, there were a lot of us there, and being able to go back to work, but to go back to work, we realized how we had to carry out some tests for these speakers. And we were actually testing them to realize whether they were fit for work. So we developed some partnerships with some health organizations in order to test our workers for COVID-19. And we carried out more than 1,000 tests, and we realized that many of these speakers actually were asymptomatic. So they were sick, but they didn't know. And luckily, we only had one case of one waste speaker that passed away, but she was not an active worker. She was isolated. And thank God, even though there were many cases of workers in Brazil who passed away, in our cooperative, it was only one worker. And after this, we realized that we had to do a lot to have access to the vaccine. We had to reach the public ministry. We had to reach several government authorities in order to show them how important it was for us to be vaccinated. We needed to show that it was a priority for waste speakers to be vaccinated. We could do our best if we are protected. If we are not protected, we cannot work. And there's now more waste that could be infected, not only domestic waste, but also waste from hospitals. So all these waste could be contaminated, and this is the reason why we needed to have priority for vaccination, especially in order to protect our workers. And these results were very important for us. We worked with lawyers to help us include waste speakers on the list. And we knew that before, waste speakers were never seen as a priority. And we used the test results that we had in order to show that we needed to be prioritized. And after that, we as waste speakers were allowed to receive the vaccine, and we were more than 1,500 speakers that in 2 days were vaccinated. And this was a very moving situation because we had speakers who lost their parents, their friends, their families because of COVID-19, and by being vaccinated, they were so happy. Many of them were crying, and they were not crying because they were in pain. They were actually in pain, but inside, because they were feeling my mother, my uncle, my friend, they could have been saved with this vaccine. If the vaccine in Brazil was actually offered at the beginning to those who were a priority, but because of the internal politics in Brazil, we were not considered a priority from the very beginning. So we need to know that what happens first, what comes first is life. But unfortunately, in Brazil, the vaccine was not taken seriously at the beginning. And unfortunately, the vaccine became a political issue. And then many waste speakers suffered because of this sad situation that took place with the vaccines. So we as speakers were so happy when we were able to receive the vaccine, you know? So the situation in Brazil was very, very sad. Many waste speakers were affected by this pandemic in terms of their health, their work, their income. And these are going to be generations that are going to be suffering, but learning a lot after this. But this was a very negative impact for our sector. So this is what I wanted to say, what I wanted to share with you. I used the right time, I hope. And I would like to thank you once again for inviting me. And we waste speakers have a lot of solidarity in every categories of informal workers, because we know that workers are responsible in our sector. We know that we are very important for the environmental, economic, and social spheres. We generate work, we generate income, and we generate benefits for the environment. We generate benefits for the use of public resources in the right way. So I just wanted to thank you once again. Thank you very much.
Thank you very much for this touching experience and for the dimension of the challenge you assume, all the movement assume, not only with your sector of Catadores, but with other one. I want to introduce now Wisborne Malaya. He's the General Secretary of Zimbabwe Chamber of Informal Economy Association of Zimbabwe. Thank you very much for coming, Wisborne. The floor is in your mic.
Thank you, Federico. Good afternoon to you all. I'm humbled to be part of this webinar. Greetings to everyone, the whole WIEGO family, the workers, informal workers family. It is important that we meet and share our experiences in times like this of COVID-19. Quickly, I will go into my task for the afternoon. I will try to share my screen. Is the host able to allow me to share my screen?
Just give me a minute.
You should be okay now, Wisborne.
Yeah, you can.
Okay. Thank you. So right. Are you, maybe, can you see my screen now?
Yes.
Okay, thank you very much. Yeah, so I will just quickly share what has happened. I think when COVID-19 came, it was a big surprise even to workers in the informal economy in Zimbabwe, especially with our government. They quickly jumped into putting up some measures to try and curb the spread of the pandemic. And those measures were very harsh on workers and traders in the informal economy, where the lockdown imposed and did not allow people to trade, and demolitions were taking place at people's workplaces. So it was a very, very bad patch. So when the vaccination program started in the country, they also were prioritizing those whom they were calling essential workers. And we started speaking the language to push the agenda for workers and traders in the informal economy to be part of the essential workers, so that they can also be allowed to trade. And so I will just go straight to my notes, where on number one, I'm just sharing to say we have encouraged members to be vaccinated through our WhatsApp platforms as an organization. We have structures, 46 structures across the whole country. And within those structures, each and every territorial structure has got a WhatsApp group where the members in that area belong to the WhatsApp. We then also have some leadership WhatsApp group, like for every territory, there is a territorial president. So we have a presidium WhatsApp group, a secretariat WhatsApp group. So I'm just sharing to make you understand that we have been using these WhatsApp groups to disseminate information to as many of the members to understand the importance of being vaccinated or anything associated with COVID-19 or the action points of the organization at this juncture as we talk of vaccination. So this has turned to be a very good strategy to disseminate information to as many members. We have also so from the 46 territories, every territory has got an average of territorial leadership of about 10 people. And this amounts to 460 territorial leaders. And we have encouraged to say, as leaders, we should lead by example. We encouraged as many of the leaders to be vaccinated. And I can confirm to this day, we have out of the 460 leaders, 391 of our leaders have been vaccinated. And this is quite encouraging because even the people with disabilities who are within the leadership structures have also gone on board and they've been vaccinated, as well as the youths. We still have some few leaders who are not yet vaccinated. Some are still a bit adamant, but we are happy the majority have really come on board. Then we also used our social media platforms to also communicate the vaccination issue, the importance of being vaccinated, targeting the members and the general public. Because we are saying as workers in the informal economy, we don't live in our own island. We live in communities. We have relatives. So as we're encouraging the members, we're also telling them to also encourage their other family members, their community members, as well as their relatives, to also get vaccinated. We then also designed a vaccination flyer, which we have also used to post on our platforms. I think just at the bottom, you are going to see the sample of the flyer. It is just simple and giving simple communication as part of encouraging people to be vaccinated. We also requested one of our youth members who is into music to just do a jingle song on vaccination, and which we have also spread across our platforms. And we are still using this one. We are going to have some radio sessions very soon, national radio sessions, and we are also going to make sure it's played on the national radio sessions as part of encouraging the informal workers across board to be vaccinated. And the jingle song, I hope somebody, Christy, we hope maybe somebody will just play the song. So I'm going to reserve certainly a minute for that to happen. Then we have individual testimonies, people, members, like I said, the leaders have been vaccinated. So when they get vaccinated, the leaders, we record them. They do just a small recording, communicating their experience about the vaccination process which has taken place, and telling people, those who are just afraid, who are fearing nothing, to be just told, no, there's nothing to be afraid of. You can go and get vaccinated. With those who have done the first jab, communicator, I've done my first jab, please, I encourage you, go and do your first jab. Those who have taken the second jab, doing the same. And through this encouragement, we have also seen a very good process where some leaders have become very, very innovative and communicating, networking with their local authorities and having members being vaccinated directly at the marketplace. So the vaccination team would come at the marketplace and vaccinate people there. So this is what has happened. But nevertheless, this has also come with its own challenges where there are religious beliefs in the country which are totally against the vaccination program. And we also have members who belong to such beliefs. So it's a bit of a situation we have in the system, but the encouragement is still ongoing. We also have fake news, which sometimes has been spreading through the WhatsApp platforms, instilling fear in members. And at the end of the day, some have continued to be doubting Thomas. But we hope as time goes on, they are going to come back to order, because the truth of the matter, COVID has killed people in Zimbabwe. In terms of the media publicity, I think our country has not been very open about the way COVID has been killing people, but this is the truth on the ground. So many people are getting vaccinated. And as we speak, we also have the issue of, slow provision of the vaccination in some areas, especially the remote areas, where sometimes accessibility or other challenges are causing them not to access the vaccination on time. So these are the issues. But there is a key obligation which has been put up by the government. In a way, it's more of making vaccination mandatory, where churches, people can go to their churches on condition that they've been vaccinated, they've received their 2 jabs. That is a condition. In some restaurants, you can't get in there, you can't sit in there without showing your vaccination certificate. So are some shops. And so generally, things are now shifting to sort of making vaccination a compulsory program. And it's already under contestation. Our trade union movement motherboard, they've taken the government to the courts because of that issue, but that's what is on the ground. So for just a minute more, this clip I'm just showing you, this is our Vice National President, Mr. Constantino Chiwengwa. He was presenting on issue of vaccination. So I just took this to share, to say even the government, they have really taken on board our cry to say, okay, vendors and workers in the informal economy, they also need to be vaccinated. And he was just encouraging to say, though it was like a very military statement to say, no vaccination, no table. The table he was referring to is a store, an operational place for the vendor to say, if you are not vaccinated, you are not going to get a place to work. So it was more of military, but generally, if we look at it from another end, it's just also a language to try and encourage as many people in the informal economy to also get vaccinated for their safety and the safety of their clients. Then this is the flyer which we just designed as an organization, and we have distributed this across all our social media platforms and even our website and so forth. The whole idea, we are just trying to play our role to promote as many people to make sure they get vaccinated for the safety of all. And it has got just 4 key things one should do as a member. And that's what is written. They get vaccinated today regularly, sanitize, maintain social distance, and mask up. Lastly, but not least, I would then request, I'm not sure Christy who is going to do it for us, just a 1-minute jingle for us on the song, which we just, one of our youth members did for us as part of the vaccination campaign program for the year. Thank you.
Sure, I'm going to play that now.
Here it comes.
ichangobva kundifonera zvikanzi denda iri zvatiomera tapindirwa nehosha prevention yakakosha mwana wese chiyanda tifamba uzvichengetedze isu tazviramba aingatirwise foma weka karemara shandira Zimbabwe Chamber of Informal Economic Association. Don't be another statistic of the COVID pandemic. Stay safe. Always sanitize. Wash your hands. Use running water. Maintain social distance. And always mask up. Yes, encourages
Okay, in the interest of time, I've just cut it because the last part is just the repetition of the Shona chorus. But I think this is the message which we are spreading across in terms of promoting members to make sure they get vaccinated. Thank you very much.
Thank you very much, Wisborn, for sharing this experience in a context of few amount of vaccines for the country. You remember this map that Christy present. So this make so important this effort to provide access to vaccine to the workers. I want to invite Farida Ben, representative of Sewa Barat, to present his experience, her experience, sorry. Farida Ben, are you there?
I
It's
would like to make,
Rima Ben.
it's
Okay.
Rima Ben. Federico.
Yeah, excuse me, please go ahead. Are you there? Maybe mute.
Rima Ben.
Rima, welcome. You're mute.
Okay. सभी को मेरा नमस्ते.
Everybody, a warm good evening. All my brothers and sisters. My name is Rima Mishra.
और मैं एक घर खाता कामदार हूँ और सेवा में आगवान बहन हूँ पिछले 2 साल से और 6 महीने से मैं बोर्ड मेंबर हूँ रोआब में.
I am a board member since 6 months.
और मैं 2014 से सेवा में काम करती हूँ.
I am working since 2014 in the Seva Sadan Kendra.
तो जैसे कि ये जब बीमारी आई.
So as you know, when this pandemic hit in the month of May, our work was hampered very much. The disease was spreading very heavily. So there were, yeah, the work was, the disease was so bad that the work was affecting. Even the household works were also pending, and after that, when the vaccination started, like in the May month only the vaccination came that the over 18 years age will get that vaccine. Then the people got panicked and there were spreaded rumors that if we took vaccine then people can die. So if we take vaccine then people develop fever and all. So there was a fear which was spreaded all around. So after that, we talked in our Seva Kendra regarding the vaccination that it is being delayed. So what to do in this situation? After that, we started getting work from different areas. So whatever work we were getting, we also getting feared that we should do it or not for the pandemic reason. Not only fear of mine, but also my family's fear. So whatever we bought or whatever we have to touch, we used to sanitize it, then we used to touch it. Then after that, we started working slowly. So when we need to encourage people for the vaccinations, so at that time, how to do that? Then we talked to Sarita Ben, who is in the health department, Sarita Chauhan Ben. So she shared some videos to us and explained that how we have to convince those people for the vaccinations. Then we showed those videos to everyone and tried to convince them for the vaccine. So that all of these things like which ages are available like 1845. Yeah, there were not there were less populated areas, so we go and encouraged people. We also called peoples and told him about the vaccination, so they get prepared. Then they were asking that how to register for the vaccine. So that information we also collect from the Seva and provide it to them. So whatever information we were getting from the Seva Sadan, we passed them all to them. So some people, like, they were telling us that we tried and we were unable to get the vaccine. Then I also tried myself to online registration of me and other people's. So daily we used to check that the site is open or not, registrations are open or not. So at 29, I got registered, and on 30, I got the vaccine. Then I shared my thoughts. Then they all said that, yeah, we also want to take vaccine. Then they shared their Aadhaar card and phone numbers to me. Also given their phones to us that please use my phone and register myself to the vaccine portal. Then after the camp was set in the Gurgaon, so our sisters gone there through the Seva Sadan, through the Ola cab. The ride was 1 to 1.5 hours long. So they reached there around 12 p.m. They reached there around 12 p.m. and their number, they got their number around 6 p.m. for the vaccination. Okay, so 42 people gone there, only 8 of them were vaccinated. Okay, after 8, the vaccine was over. So there were very much chaos. And then after we took the Ola and returned to home, they were very much worried. Yeah. So the camp which were there, so they helped them for food and all. Some of the people's sisters, they left their 2-year, 3-year-old childs at home for the vaccine. Then they told that we will go and camp in your area. So here the staffs of Seva Sadan, Seva Bharat, they made a list of all those sisters. In that list, Aadhaar number, phone number, name, address were mapped. Around 300 people were registered in that list. So now when the camp will come and set up, so they will get the vaccines. So the work is currently going on. And those who were much worried of food and all groceries, so we also provided them too. And keep my thoughts in this floor.
Thank you very much, Rima, and thank you very much, Pallavi, who put supplementary information about this experience and the leadership of Rima in its community. And again, thank you very much for sharing this experience from India. I will give you now the word to Carmen Brides. She's the director of the Union of Auxiliary Personnel of Private Houses of Argentina. Carmen, bienvenida.
Hola, buenas tardes, buenos días, buenas tardes.
Good morning, good afternoon, good evening, depending upon where you are. Well, I want to tell you a little bit about the experience that we have in Argentina with the vaccination campaigns, the articulations, and also I want to talk to you about the regional work that's going on. I'm the vice president of the International Federation of Domestic Workers, and the importance that the experience exchange between the different unions of the federation at the regional level. Now, for us, the pandemics, although it was terrifying for all the organizations and all the activities of the world and the people in the world, we also believe that it was overall made the domestic work sector something visible. It became incredibly visible given all the problems that we were going through at the time. Like Deborah just mentioned, my colleague from Argentina mentioned about the recyclers. Although in Argentina we have a law for domestic workers, in Argentina, in spite of the law, we still have 1,300,000 unregistered domestic workers with no social security. And also the importance of the International Labor Organization to deal with that. And WIEGO was working in that experience within the ILO, and the fact that the health has to be of equal access for both formal and informal workers. We must say that we need to differentiate the registration of the places where are protective laws of workers that are not registered, and they end up within informality, but there is a law that protects them. So at that point, we need to keep fighting first for registering workers in Social Security, and second, for the colleagues of different works in informal economy with no protective measures. In Argentina, the major problem that we have, as Deborah mentioned, is the invisible quality of the workers in terms of vaccinations and protection. And from our organization in Argentina, as domestic workers, we have three institutions: the Domestic Worker Federation, which is a federal organization. It's the bigger one in Argentina, but we have in our union the responsibility of the social security of the workers. We have their health policies, and we provide health to the workers of the area. But we also have a school, the training school, not only for trades, but also for education in general at the national level. And the three institutions that we are one, which is the mother union, and one is the union, and the other one is the daughters of those organizations. And we have worked together to provide information to all domestic workers, both formal and informal, given the situation we were going through. We had, as an organization, we had to adjust the issue of information and health, and especially how we could start working when the pandemic started.
And this is when we dealt with a very important team. We've worked with sanitation physicians, we articulated with workers' comms organizations, with physicians, with lawyers, and we managed to prepare a specific protocol for domestic workers in order to protect them from COVID, not only for workers, but also for employers. And why am I saying this? Because it seemed like at the beginning of the pandemic, the only persons who could be contagious were domestic workers, but not employers. And COVID doesn't really choose whether you're an employer or a worker to be contagious, but us as a union, we needed to protect our sector, our people. So that is why we started articulating this protocol on a national level, and we started to submit it before each and every one of the ministries, not only those related to health, but also related to work, the Ministry of Women, And we did it both nationally and provincially. What we needed was that for this protocol to become official, to become formalized. So workers were supposed to provide the necessary PPEs like masks and alcohol gel. And I don't want to forget to mention that the international organization did some contributions, money contributions to our organizations, where we could use that money to provide our formal or informal workers with assistance. It was a small amount of money because we have many domestic workers, but at least it was some sort of relief for some people. In my organization, we gave out 3,000 masks and bottles of gel alcohol, and then we also provided some food for domestic workers. This pandemic saw many of our colleagues being fired, and we saw many cruel attitudes towards our workers. Many workers became sort of invisible in Argentina, in spite of the fact that the government had issued a decree that enabled domestic workers to not go to their work. But still, in spite of that decree, employers, as domestic workers, also deal with caring for young people and elderly people, and they were deemed essential people. But in spite of that, workers would change the category of their own employees to force them to work, even though when they were allowed not to. This was a continuous struggle. We had to continue providing protection to the domestic workers who, although they were not authorized to work, employers actually made them work. And the executive branch said, you as employers must pay the full salary to domestic workers, even though they're not going to your houses. Unfortunately, that did not happen. What workers did, or employers did, was just change their category so that they were not considered essential workers, or just stopped paying their salaries. So the trade unions had to start doing advocacy actions in all sectors. One of the most important things that we did was to articulate with the Domestic Workers Union and the Home-Based Workers Union. We talked to them about the fact that this fourth category of workers, who were essential workers, the people who took care of children, adolescents, and elderly people, they were not considered as essential workers for vaccines. And this is something that we, at the time, thought it was incredible, because we couldn't believe that they were, as physicians, nurses, sanitation workers, and other activities were considered essential workers, but domestic workers had been defined as essential workers. Then how could we not enroll for a vaccine? So then we worked with different sectors in order to be able to submit a report asking for vaccines, not only for domestic workers, but also for home-based workers who were actually going to work every day, but they were doing so illegally because it was forbidden at the time for them to work. Then, of course, we had to start getting to know the whole vaccination process. It was different in every country. Of course, in some countries, like in Paraguay, they started with physicians. In Argentina, it was done due to age groups. We started with the elderly people from 70 to 80 years old or above. And also, some people who had some sort of risky medical conditions were also vaccinated first or enrolled first. And of course, then those home workers or domestic workers who had some medical conditions could be vaccinated. The process moved then forward through the different age groups. We were able to include domestic workers as essential workers, and by different mechanisms, we were able to provide subsidies for domestic workers who had been victims of domestic abuse in their work, and that was important for us as well. This year, we were able to get a bonus for seniority for our workers, and all these specific situations in which we gain some rights and gain some benefits for us as an organization, that was and still is something that we do with our hard work in order to finally get our vaccines. As an organization, we interacted with the provincial authorities to be able to launch campaigns from our organizations and to actually enroll our domestic workers for them to be able to get the first and second doses. In our organization, nationally speaking, you see that we have tables in the pictures. We put our tables out on the streets for women to enroll for a vaccine, because as my colleague Deborah said, many of these domestic workers have no internet access. They don't know how to fill out a form online to be able to enroll for a vaccine, and many of them don't really know why it's important and beneficial to get a vaccine. So for us, it was important to provide this initiative and to work with all the different parties, especially in the province of Buenos Aires. We worked with the different localities and municipalities and the health ministry. And it was quite important, a massive effort through schools. We helped enroll for the vaccines and also enroll for all the benefits that we have achieved throughout the pandemic. We have given awareness trainings, but we of course first had to train our own leaders so that we could then provide these awareness trainings or workshops in each of our organizations. For us, schools are the main pillar. From a school, from the teaching experience, we can reach all our workers, not only face-to-face, but via Zoom meetings like this one. We provide information on where to get a vaccine. Nowadays in Argentina, with your ID card, you can just get a first dose of the vaccine in certain vaccinations locations. We are quickly progressing on the amount of workers that are being vaccinated from all different types of work, specializations, but we really depend on the vaccine shipments that get to our country. We have a lower rate of infected people. We can actually see that in our health services. At the beginning, we were talking about 30, 40, 50 colleagues that were infected with COVID. Nowadays, we see 1 or 2 persons infected. Some days we have no colleagues that have COVID at the moment. So it's very important to keep working on the campaign. And it is also very important to have a protocol, because this is ongoing. Not only domestic workers, but employers need to have a protocol. We need to continue taking care of each other. Even though we may have 1 or 2 doses of the vaccine, we can still be contagious. We must know that, and we need to continue taking care of each other. This is something that we continue to explain to our workers, whether they are formal or informal. And I think it was also very important the fact that we could work with social media. In each of our social media outlets, we were able to communicate and to articulate with different government sectors and also with different organizations like yourself, like WIEGO, the Federation, WITA as well. and many other organizations that we aligned with to provide workshops on protocols, on COVID disease. And of course, we have to know how important it is for people to get vaccines all over the world. From our organization, we're extremely happy with everything that we have achieved so far and everything we have done, but we know that there is still a long way to go and we need to keep fighting. And as I say at the end of my presentation, together we must keep taking care of each other. Thank you.
Por esta importante
Thank you,
presentación.
Carmen, for this important presentation.
Patience and indulgence, because we have another presentation, the last one, which is so important because involves citizens in the process. I just want to give the floor to Eva Mokoena. She's the chairperson of the African Reclaimers Organization from South Africa. Eva, I will share my screen with your presentation. Please take the micro.
Hello, everyone. I'm Eva Mukbena, chairperson of ARO. I'm based in the city of Johannesburg in Gauteng. So here I'm going to talk about the first slide. It's talking about the training where we were training reclaimers about the vaccination and showing them how is the virus between the virus and the influenza. This is where we're teaching reclaimers on showing them on the slide here that Federico, you're confusing me now. You're taking this one and that one and that one.
Yeah, sorry. This is the one. Please
Okay,
set when you want. I pass the slide. So sorry.
Okay, this is the first slide. So I think you should start at the first slide. So sorry about that, everyone. Here is where we started the training. Okay, thank you. You can pass. Here is where we started the training of reclaimers so that they can go and get vaccinated. We are doing a train the trainee. We collaborated with Green Cape so that we can get material to do the course. You can go to the next slide, please. The project of the scope of the project. We train people on COVID because what we found is that most of the reclaimers, they don't believe that COVID is real. But seeing things happening and people have been diagnosed with COVID, that's when they started to believe. But most of them, they don't want to go and vaccinate because of the symptoms that people are getting when they're coming back from vaccinations. So we've got this training development training material for reclaimers regarding safe collection with specific reference to COVID-19. Number 2 is train trainees in the city of Johannesburg area to deliver training on the above identified aspect in English. So we train people to go and train others. But the thing is that we have to translate English into African languages, like in different African languages like Sotho, Zulu, Xhosa, Tsonga. So the specific chart of the task of the project, phase 1, we develop training material on COVID and safe collection. We train reclaimers from the street and from the landfill on how to stay safe. Sometimes we even giving them masks so that they can protect themselves. Then we've got groups that we train. The groups are containing 5 people in ones. And we practice social distancing. Our facilitator is Eliko Disang. who's busy helping us with those trainings. Phase 2 is developing training material to assist in the integration of the informal and formal recyclable sectors. So our phase 2 is where we train the reclaimers so that they can go even on the buyback centers and train the owners of the buyback centers on how to practice and on how to deal with the vaccination. The next slide. We started training people following the COVID-19 restrictions and lockdown. So that's when we started. I think we started last year when we were talking to people about COVID-19, the importance of being protected from getting the COVID-19. The facilitator travels, as I was saying, it's Elikodi-sang. Trainings, we're taking them outdoors, as you can see on the other slide, where we were showing people on how the virus is functioning and on how it's changing. And when we teach people about this COVID-19, we sit down and talk to them about their experience and the way they understand this virus. We limit traditional method of using games and other learning activities because most of the things that we've managed to get is that most of the people, they don't believe in social distancing, or always you'll find them in groups, touching each other without masks, talking everywhere. So the next slide, please. Here, it's in Orange Farm, where I'm staying. We were training. It was me, Spiwe, and Tise. So these are the reclaimers that I was working with in Palm Springs landfill, where Elikodi-sang was teaching us about the COVID-19 vaccination and on how to register reclaimers so that they can go and get vaccinated. The next slide, please. COVID training activities. We held focus groups, workshop to test training material. Materials have been verified by medical practitioners to make sure that they are legit. They don't cause any harm to anybody. Focus has moved from safe collection to dealing with keeping safe and vaccine assistance. Vaccine registration and dealing within information and field observation and assistance of trainers. We make sure that we tell people where to go and register if we didn't register them, and where to go and get vaccinated. Because what we've noticed is that people are afraid to go and vaccinate. Even me, I was one of them who were afraid, because many of the things that had happened in these vaccinations, you'll find that you go there, they don't teach you anything about this vaccination thing. They just come, they take your ID, they vaccinate you, you come back. They don't even teach you anything. You come here, you collapse, there are after effects about that vaccination. So where we are staying in the locations, many people have died because of that, because they didn't get checked, they didn't teach them about this vaccine. They just go, they vaccinated, then they come back. And the first group we've been training, it's about 50 trainings that we've done so far in the city of Joburg. Can I get to the next slide, please? Here it's in Palm Springs landfill site. Thank you. Here is in Palm Springs landfill site where we were teaching people about the coronavirus and about the importance of being vaccinated. Most of the people, you can see, if you see properly, like most of the reclaimers, they didn't come because they think that we are playing games about this COVID-19 thing. So, but some they did come, especially the elderly women and some of the small buyback center owners. They came to come and listen on what we are about to say. We taught them about this vaccination thing, and we told them the importance of being vaccinated and the truth that if you are not being well checked before you go and vaccinate, there are after effects about this vaccination. We didn't lie to them because most of them are worried that no, my friend died after vaccinating, then someone has done this. So because when we teach them, we sit down, we talk to them, we listen to their stories. They explain to us how the vaccination has been going on in their places where they're staying. Next slide, please. As I've said before, we have trained about 50 reclaimers in Joburg. When we train people, we also register them. In Brixton, we've got a project there. Every time or every Tuesday we went there, then we were working with the community forum who are helping us to transport reclaimers to the vaccination stations. To tell the truth, people they don't want to vaccinate. They are afraid. They are really afraid because they think the vaccination is going to kill them. But we keep on pushing because no one is looking after reclaimers. So we are the ones who have to take care of ourselves. The next slide, please. Here is one of the comrades, Distrito. She's a committee member in Palm Springs, was registering kids who wanted to go and vaccinate. The next slide, please. Now, because of the trainings that we've been doing, because of the going all around the city of Joburg, teaching people about COVID-19, people they now believe that COVID-19 is real. Although they are afraid because social media talk about this and that and that and that. So some of them they do listen to things that are happening in social media, some they don't. And the government is doing a little to educate people about this COVID-19, especially the informal workers. They don't know anything about this vaccination or anything. It just come and say, go and vaccinate, without even teaching them how this thing is working. And more especially here, at first, this vaccination thing has been going on in private hospitals. It started recently in public hospitals. So people, they still hesitate to go there. When we train people, as I've said before, when we train people, we listen to them and their experience about this vaccination thing, the way they understand it, the way they feel about it. That's how we do our training. We train them, then we sit down, we listen to them. They talk to us about everything concerning this COVID-19 and the symptoms of it. Some, they see the symptoms, but they don't understand it. What is it? They think, no, it's just a fever. Then the next morning, someone is gone. Like in Palm Springs, we've lost two reclaimers due to that because someone just said, no, I'm blocked. My throat is sore. Then the next morning, she's gone. We managed to sign up the majority of people with passport after the training session, but we are still struggling to help those who don't have IDs or passports. And some they do want to go and vaccinate, but the thing is that the system doesn't allow us to register them without proof of identity. The next slide, please. Here, this is where we register reclaimers who are going to vaccinate after the training that we've been conducted. This is happening in Braamfontein in Metro Center. There is a place where reclaimers are staying in Metro Center. So we train them, we talk to them. After that, they come and sign to go and vaccinate. Thank you. The next slide.
That was the last one, Eva.
Thank you.
Thank you very much, Eva, for sharing this experience and to share with us this picture of the constraints and barriers in the grassroots scenario. I will give you, Christy, the mic to make this last part of the webinar.
Sorry, Federico. Federico.
Yeah, I hear you.
Okay, what I forgot to talk about is last year when COVID started, the second day of lockdown, reclaimers were falling on the street because of hunger. That's when Arrow started to be active in finding a solution to give them food and soaps, bleach, so that they can make homemade sanitizers, and teaching them about how not to conduct the virus while they are busy working. And even now, every week we've collaborated with chefs with passion who are donating vegetables and some of the food parcels so that we can donate to reclaimers. Even now, we're still doing it. Thank you.
Okay. Thank you very much, everybody, for all of your testimonies today, sharing all of your important work, and, you know, proving to us, you know, the power of solidarity. Thank you so much. We really, I think I speak for everybody when I say that we really, really touched by all of your presentations today. So thank you. We have, as you can see, we've gone quite over time. So we only have a little bit of time for a Q&A. I can see that some people have put some messages in the chat and also in the Q&A box. But I think for now, we're going to keep it to one question in the Q&A box, which can be asked to every presenter. So one question directed to all 6 of you. What do you think, how do you think you could be supported by WIEGO or other organizations? Could you tell me in one short sentence what could be done to best support your efforts on the ground?
What about if we give the word based on the order of presentation, and we start with Deborah? Debbie, ¿podrías compartirnos cómo crees que WIEGO...
Deborah, would you share with us how do you think that WIEGO and other support organizations can provide support to your job? Sorry, could you ask the question again? Sure. In just one phrase, how do you think that entities like WIEGO or other entities like us can support you in this particular process? Well, we need to have strength in our health teams or sanitary teams. Thank you. I will give the floor now to Aline then.
So here, WIEGO has a strong participation with us. There's they have guidance, as Eva spoke, to ensure this training process of waste pickers, but also strengthening these institutions. So strengthening these institutions is also a way to support us. Thank you, Aline.
Wisborne, are you there?
Yes, I am there.
Okay, please.
Okay, I didn't know it's my chance. Thank you. So I think just a quick one. I think we need to keep on collecting data on the people to say how many have been vaccinated and encouraging people to continue to be vaccinated. Then number two, maybe we may need to just put up a small program which we can call Life After Vaccination, where we just wait to say people should continue to know about COVID-19. Does it mean when you are vaccinated, you are no longer going to die of COVID? So we need to give that awareness on life after vaccination.
Thank you, Wisborne, for that words. Rina Ben, are you there? Or Pallavi?
Rima Ben ya Pal.
Can see Rina.
Rima Ben?
Yeah.
If
not, we continue with Carmen and then try to contact Rina or Pallavi. Carmen, give you the word.
Sí, bueno, nosotros creemos que hay que seguir
We
trabajando.
believe that we need to continue working on information, on providing information everywhere, information of all kinds. We need to keep articulating with the government to have public policies, actions in terms of enrollment to vaccines, in terms of, and just like my colleague said, we need to keep instilling the fact that there is a life after the vaccine, that we need to keep taking care of each other, because we see that many people who have been vaccinated, not only in our sector, but in the whole of the society, people who have been vaccinated stop taking care and stop taking precautionary measures with using masks and everything else. And they end up really disseminating the disease, even actually bringing about different varieties. So I think the importance of all sectors and all the society as a whole is the responsibility that we have as human beings to take care of each other. And that is something that we need to consider. Each of us is responsible for our own health, but also for the health of the one next to us. So we need to keep working on the vaccination efforts and on the importance of being vaccinated, and to provide the information on how to actually be able to access to vaccines. Thank you, Carmen.
Okay, Federico, thank you so much. You know what I've noticed is that most of the informal workers, not just dwelling on the reclaimers only. The government doesn't care about us. The only thing that we have to do is to stand up on our own, do our own research, and then spread the word amongst ourselves and help each other to go and get vaccinated. You know, the truth about this vaccinating is to tell the people the way it's gonna react, the way it's gonna show in your body that it's working. And the real truth is that you have to tell them, even if you can get vaccinated, it doesn't mean you are safe from COVID. You can also get COVID, but it's not going to attack you the way it attacks you when you are not vaccinated. And again, we would like to have more support from companies, like organizations like WIEGO, like big organizations, to have support in order for this word to be spread, because most of us are struggling, especially when it comes to traveling and everything. Most of the claimers are getting left behind because of the places they stay. They are far, we can't get there. But when we have time to do so, I think it's for us to conquer this and spread the word and teach other reclaimers. And I've seen here on the group, there is someone who's coming from, who's helping the immigrants. I would like to be in touch with that person, because here where I am, as I'm the one who's dealing with the people who are coming from outside, especially the immigrants, I would like to get help so that they can get papers, especially people from outside South Africa. It's really hectic. Even the ones that are from South Africa, some of them, they don't have IDs. So it's really hard for them to get vaccinated. So we really need help. Thank you so much.
Thank you, Eva. I give you the mic, Christy. Sorry.
Thank you so much. Thank you so much to all of you. So just before we close, I want to say a massive thank you to everybody here who has shared their experiences. Thank you so much. We're very, very privileged to be able to listen and learn from you. Thank you so much to all of you for attending this webinar. I'm sorry again that it's gone beyond the allocated time, but I think we also benefited from the extra time in any case. Thank you so much to everybody once again. I did put in the chat box that this webinar is just the first step, really. The first step in this work, the first intervention, the start of a conversation. And so what we really want to do is to stay in contact with as many of you as possible. Perhaps that may come in the form of future webinars, etc., but we really do want to continue this conversation. So we have started a publicly accessible Google Drive folder, which will be full of materials, including recordings of this presentation today in the various languages. So we will be sending a link to everyone here in the coming days, so you have access to that. And we really want to stay in touch with all of you. So again, thank you so much to everybody, and wishing you a lovely rest of morning, afternoon, evening, night, and we'll be in contact soon. Thank you.
Thank you very much to everybody.